Hello, I am Dr. Neetu Rathi. Welcome to all of you on my channel Rid of Pain Physiotherapy. Today we are going to discuss about cervical spondylosis. Now, what is cervical spondylosis? Cervical means गर्दन गर्दन में होने वाली टाइम के साथ जो डिजनरेटिव डिजीज है आर्थराइटिस के जैसा उसको हम सर्वाइकल स्पॉन्डाइलोसिस कहते हैं। बहुत सारे लोग आते हैं, ये पूछते हैं कि मुझे कमर में दर्द है तो क्या मुझे सर्वाइकल स्पॉन्डाइलोसिस है। तो आज इस सवाल का जवाब आप सभी को मेरे इस वीडियो के अंत तक मिल जाएगा। तो सर्वाइकल स्पॉन्डाइलोसिस क्या होता है? सर्वाइकल स्पॉन्डाइलोसिस एक डिजनरेटिव डिजीज़ है जो एज के साथ सभी को होती है और ज़्यादा कॉमन है कि जिनको सिटिंग का ज़्यादा जॉब रहती है, जिनका काम ज़्यादा सिटिंग से रिलेटेड रहता है। इन जनरल टर्म सर्वाइकल स्पॉन्डाइलोसिस इज वियर एंड टियर ऑफ बोन्स एंड डिस्क्स ऑफ सर्वाइकल एरिया। तो बोन्स, these are the cervical bones, and if you see, there is present a gel like structure that is called disc. Disc is also a causing factor of cervical spondylosis if it goes in dehydration. Like with the passage of time, disc goes started dehydrating and it can create pain in neck. Also, it can bulge or it can herniate from any either right side or either left side. This can also cause pain or radiating pain in arms. Next can be spur. Spur these are the bones, and if bone edges start growing at the corners, so these are called spurs. Spur cause pain in the neck and also prevent lock the movement of the neck. And along with that, sometimes an injury like any accident or any injury happened in neck can cause the neck pain or cervical spondylosis. Means this can accelerate the degeneration of the disc or spine. Along with that, any factor that is most important is overuse injury. Overuse injury is the repetitive movement or workload can also cause cervical spondylosis. It is the main factor which is causing cervical spondylosis in the early age. Like because of overuse injuries, the disease can start in the early age of 30s. Otherwise, the degeneration can start after 40 or 50s. But this accelerates the degeneration process in a human being. Now, how can you say a person is having cervical spondylosis? He will having pain in neck, in shoulders, or maybe feeling of pain in arms, numbness, or irritation in the neck and shoulder, lack of sleep, and lack of movement in the neck muscles. So, how can you prevent yourself from cervical spondylosis? So there are few exercises that a person can do at his home or at the workplace or in office if he is having workload from 9 to 5 or more than that, or you can say person's office work is for long duration, like he or she has to sit for long hours in front of screen. So you should avoid yourself for sustain a specific one posture. So you must start doing some few movements after some breaks like 30 minutes or 1 hour, so you can prevent yourself from cervical spondylosis. So first is the range of motion exercises. You must do flexion and extension, like you bend your neck in forward direction completely and then take your neck backward. Repeat this 10 to 20 times, and then you can rotate in your left side and in your right side. So these are range of motion exercises. You can do these exercises in your office after every 30 minutes or 1 hour whenever you feel free. Along with that, you must do few stretching exercises like take your neck in side bend and stretch yourself completely in one direction, and then take your neck in another ways and stretch it likewise. After that, you bend your neck or take your neck in 45-degree rotation and take it downwards and give a little overpressure on the head of your with the same hand, and likewise in the opposite direction. These are stretching exercises, so you can prevent your muscles to get fatigue or get in stiffness. Along with that, you can do strengthening exercises. So you must put your hand in front of your forehead and give a pressure on your neck, and your neck should be static, or on counter force must be on the hand to prevent any movement, and hold it for count of 5 or 10 and then relax. Likewise, take your hand behind your head and give slight overpressure with your hands on the head and from head to hands. 1, 2, 3, 4, 5, and then relax. Same ways, put your hand on your right side and give slight pressure on the head without having any movement. Then count till 5 to 10 and then relax. And same ways in left side. 2, 3, 4, 5. Relax. Along with that, you must do chin tuck exercise, like you have to touch your chin with your lower end of your neck, like this way. You can do this movement. Also, you must do shoulder shrug. You must take your shoulders like you have to touch your earlobes. Then take your neck likewise and do shoulder shrug. Along with that, you can do rotation of your shoulders in clockwise and then anti-clockwise. If you feel comfortable, you can do these exercises anytime in your office or at your home when you feel that you are free to do all these exercises. Still, if you are not feeling comfortable with these exercises, or you are having pain in your neck and numbness or radiculopathy in your arms, you can do like you must go to the physiotherapist to consult further to prevent yourself or to get treated your problem. So there are various therapeutic modalities that a physiotherapist can help you to get relief in your pain, like electrotherapy, including TENS, ultrasound, or IFT, or like exercises therapy, like stretching, strengthening exercises, and different advanced manual therapy technique like MFR, PRT, AMIT, myokinetic cupping therapy, dry needling, etc. With the help of these modules, a physiotherapist can treat your cervical spondylosis. And if you like my video, then share it, comment it and like it, or subscribe my YouTube channel. So thank you very much, and we'll see you next time.